Does your child have ADHD? If so, you may be considering having your child take medication. However, you likely have many important concerns that you need to have addressed in order to help make your decision. Joining us today is psychiatrist Dr. Joshua Weiner to address the most frequently encountered concerns that he hears from families trying to make this decision. I would imagine there are a lot of questions. One of the big ones I would think is are the medications safe?
So the short answer is yes. Every medication has side effects. The most common side effects with the most commonly prescribed medications for ADHD, which are the stimulants, those are medications like Ritalin and Adderall. By far, the most common side effect is decreased appetite, which is a real problem for some people. Other common side effects might be increased anxiety, difficulty falling asleep, a mood or an energy crash when the medication wears off, or sort of a blunting or flattening of personality. Now, all those other side effects that I mentioned besides the decreased appetite, they occur in maybe 15% of kids. The decreased appetite one, though, I tell everybody that's almost a guarantee that that's going to happen. But ultimately, these medications are safe.
And as a doctor, you're watching that to weigh risk versus benefit, right?
Absolutely.
What about, how often do you see misuse of these medications or people becoming addicted to them?
So, of course, that's another big concern because we hear all these stories about kids misusing these medications, particularly on college campuses and selling them and giving them away, et cetera. So that is a problem. And I've seen it a handful of times. I can't say that I've seen it all that often over my years. I don't think it's that much of a problem, certainly when you're talking about younger kids. So kids who are, elementary, middle school age, they're not going to be doing that kind of stuff. Right. It becomes more of an issue for high school and college age. But I do think that that's something that's manageable. Parents hold on to the medication, they dole it out every morning, and they watch their kid take it. So that way the kid's not hiding it, putting it in their pocket and selling it or giving it away. But when it comes to addiction, what we do know is that untreated ADHD has a clear increased risk of future addiction issues. And that's because people just don't feel like they're having success academically or professionally or maybe personally, so they self-medicate. Pretty much every study has found that treating ADHD ultimately decreases the risk of eventually using or abusing substances.
How do you respond to people who have concerns about these medications stunting growth or development?
So what I tell people is, over my 20 years of doing this, the answer to that question has changed. It's like every few years there's another study that says something slightly different. So it used to be no stunting of growth. Then it was, well, if boys take it for 3 years or longer, there's a delay in their growth spurt, but they'll be the same height ultimately. Now the most recent data suggests that there is a potential decrease or stunting of growth. However, what they found is that it's related to the ultimate load of medication that you've taken over the years. So you want to try to maybe take breaks over the summer or on the weekends from these medications. I think that ultimately what it all boils down to is the eating piece, because if you're not eating, you're not getting enough of the energy to grow. The one thing that I do tell parents is, look, I've been at this long enough now where I've treated kids for ADHD when they were 7 or 8 years old. They're now off in college. Everybody looks like they belong in their family. They're all bigger than their parents. So it's not like I'm seeing a bunch of short people where I'm wondering, oh my gosh, did I stunt their growth? So I don't think it's a big issue.
So we're almost out of time, but I want to ask, what do you say to people who have concerns about kids not learning how to manage their ADHD without the medication?
I say to them, look, what you're doing in many cases is by giving them the medication, you are teaching them how to engage, how to do things effectively. They're getting into the habit of doing homework, sitting down and having success. So I have not seen any studies that have supported that idea, that if you don't give people medication, that somehow they're more likely to outgrow it or somehow they're more likely to learn how to manage it. I would argue that maybe they're more likely to learn how to manage it by having the benefits of the medicine for a period of time.
Just a few seconds left. Any other treatments, alternative treatments that are just as good as these medications?
Unfortunately, no, right? So a lot of people might be watching this and think, oh, this guy's just pushing pills. But the reality is, if you have ADHD, you could talk to your purple, you could try taking a lot of supplements. They might help a little around the edges, but nothing is really going to have the difference that medication does. It's just the unfortunate fact.
All right, a great perspective on ADHD. Dr. Weiner, thanks.
My pleasure.